So I'm Rachel Tranter and I'm Director of GEM, and I'm in my home office, so with slightly blondish hair and blue dress with a sofa in the background. And it's really exciting to be here after so much work on this project, both in terms of kind of securing the funding, but also delivering the work with jointly with Culture, Health and Wellbeing Alliance. So fortunately, Victoria can't be here today, Victoria Hume, but she's been instrumental in this programme.
Just don't have any volume.
Can you all hear me? That
Can
would be
you hear
wonderful
me?
together. You hear me now? Sorry. Yeah. So yeah, apologies from Victoria. So just to give you a bit of background, so this was a 18-month project that was supported by the National Lottery Heritage Fund. Sorry, I always say it the wrong way around. National Lottery Heritage Fund. And our objective really was to think about creative health in museums in a really strategic way. We knew that a lot of very good work had been going on, some excellent practice in museums, but we were concerned to kind of explore how to really embed that strategically within museums. And that was really kind of the whole kind of framing of the programme. And we worked with 6 partner museums, and we'll talk about some of the detail in a moment, but just to give you an overview, and I can see that people are still coming in. So apologies if we've started.
It's called Working Together. It's embedding cultural health and wellbeing in museums. It's 6 partner projects. I think Karen might be on it as well.
Thank you. If you are in the meeting and you haven't muted, please do mute. Lovely. Right, marvellous. So a little bit more detail about this programme. So as I said a moment ago, we worked in partnership with 6 very diverse museums and heritage organisations across the UK. And these included the National Museum of the Royal Navy, Portsmouth, Newark and Sherwood District Council, Royal Museums Greenwich, the Scottish Maritime Museum, Sunderland Museum and Winter Gardens, and York Museums Trust. So those were the partner museums that we selected. We had a lot of applications, and we ended up slightly randomly with 3 maritime museums. not deliberately, but it was particularly the geography we were looking at, and also the kind of capacity to benefit from this project was a particular criteria. So we weren't particularly looking at museums that had a lot of experience in health and wellbeing. In fact, we were looking more for the capacity to benefit and improve as a result of this programme. We had a number of objectives. So as I mentioned, that we're particularly thinking about how to make health and wellbeing work more strategic within museums. Our other objectives were around, as you can see on the blue part of the slide, were broadening access to heritage for better health and wellbeing. So actually the health and wellbeing of all the participants that took place. Engaging communities facing health inequalities, so particularly thinking about areas of the country where health inequalities were a particular issue. Building creative health skills across the heritage workforce, so particularly wanted to upskill the heritage workforce in this kind of work. We wanted to also think about the well-being of museum and heritage professionals, and that actually turned out to be a very, very important part of the programme. We'll talk about as we go through. We wanted health and wellbeing to be everyday practice, so really embedded in everything that everybody does, both for staff and participants. And we wanted to look at ways in which partnerships could be strengthened with the health and community sectors. And we did quite a lot of work around this, particularly in the CPD programme, because it is quite a complex, complex web of organisations in health. And we also wanted to really drive that organisational commitment to wellbeing that we've mentioned before. So really think about that in a strategic way. So it became second nature and not kind of special one-off project. In terms of the interconnected activities, so as well as the pilot museums, we had a number of pilot projects. We also delivered a very expansive kind of training CPD programme And we'll talk a bit more about that at the end, because actually now there's an opportunity for all of you to take part in that same, or some of that same training programme. And we also embedded peer support and advocacy into the programme. So this programme was particularly underpinned by the Creative Health Quality Framework's 8 core principles. And if you've not seen that, hopefully, Kayla, you can put a link to that in the chat. And those core principles are around person-centred, equitable, safe, creative, collaborative, realistic, reflective, and sustainable. So those are all the kind of principles behind doing this work. And that framework is a framework that the Culture, Health and Wellbeing Alliance launched recently. So very much embedded those principles. And you can see a little map there where the partner museum projects are based. So just in terms of project reach, here's some nice sort of infographics on who we reached and the numbers. So there were 25 museum and heritage staff and trustees involved across those museums. There were 11 volunteers, 11 freelance creative practitioners and facilitators, 4 critical friends, 490 participants engaged in the projects. That's all the people that were involved in the partner museum projects. 280 people took part in consultations as part of the research and development work, and 11 healthcare support and community organisations partnered with the museums and heritage organisations. So a lot of different people involved, and a lot of perspectives on which to gather as part of the evaluation report that Sian's put together. So I think that's all for me for the moment, and I'm going to now hand over to Sian Hunter-Dodsworth, who is our project evaluator, to talk about the impact of working together.
Thanks so much, Rachel. Hi everyone, good afternoon. I'm Sian Rosa Hunter-Dodsworth and I'm the evaluator on Working Together, as Rachel says. Somewhat unusually, with projects of this kind, I was involved from the very start. So I joined the team at the end of 2023, and my role was to assess the impact of the programme through documenting and analysing insights, achievements and challenges as activity was underway. And so central to this process was an invitation, really, to museum partners, project participants and members of the Working Together programming team, as well as many others, to reflect on their experiences of participating in Working Together, so as to understand and shape both the individual pilot projects in the partner museums and heritage organisations, but also the wider story of change within the programme. So that was my role. And I think at its heart, Working Together was really about reimagining what museums and heritage spaces can be. So not just places for learning, not just places for conservation, but places for care, connection and well-being. And also it wasn't just one project that we were talking about or a quick single intervention. It was an 18-month journey of reflection, experimentation and growth. And I think through it, we've seen evidence of real transformation, both in the people involved and in the institutions themselves. So I'm going to be sharing with you some of our key findings and learnings from today. And I really look forward to hearing your questions and observations at the end as well. We've got some time. So what was the impact of Working Together? Well, our evaluation shows that the programme strengthened sector capability for creative health delivery. And this was first and foremost achieved through the Working Together's Knowledge and Skills Development Programme, which was offered to all participating museums. And this programme combines structured CPD opportunities, including online training sessions on topics such as co-production, safeguarding, adaptive facilitation and trauma-informed approaches, with personalised mentoring for project leads. And this focused on task-based problem solving, critical reflection and professional growth, but it also provided a lot of emotional support for those working on Working Together projects. And through their participation in the programme, individual staff members and organisations gained confidence in developing creative health work, moving from a place of uncertainty, wondering, can we really do this? How do we go about it? Toward implementing bold, inclusive and by and large participant-led projects. Now, there were some areas for improvement, which included additional support needed by project leads when starting and concluding their projects. So this was particularly around setting goals at the very outset, which people wanted a little bit more support with. But also there was some challenges and a need in the future for specific training for volunteers who play a central but really undervalued role in creative health work. However, working together was overall widely considered by museum and heritage partners as transformative, with one describing it as unbelievably inspiring and another saying it was one of the most impactful things we've done as an organisation. So also in terms of how the programme sort of built sustainable cross-sector partnerships, this was another major impact that we identified as part of our evaluation. And the programme really helped establish deep trust-based relationships between museums, freelance artists, community organisations, and health and social care providers. And I think it's important to say that freelancers in particular describe feeling respected and included in project development. And this was an experience that they noted was not always typical of their involvement in projects of this kind. One artist described this experience as a remit of generosity. She said, "I felt like I had real agency." And on the other hand, partners in healthcare, social care and community organisations valued museums and heritage organisations' flexibility and openness to collaboration. At the same time, there were still some challenges remaining around setting clear project boundaries and also managing limited partner capacity and providing assurances in terms of sustainability and equitably resourced collaborations with particularly smaller organisations and how to kind of continue that work in the future. However, the result was stronger project delivery in the short term and in the long term, the foundations for sustained capacity, advocacy and reciprocity across different sectors and different stakeholder groups as well. Our third sort of main finding was that working together helped enhance relevance through inclusive practice. It made museum and heritage practice more inclusive and particularly more relevant to communities. And projects engage people affected by trauma, social isolation, and long-term physical and mental health challenges, with the vast majority remaining engaged throughout the lifespan of their particular projects, or the ones they were involved in. And amongst many other things, participants described how the activities they'd taken part in provided them with a consistent connection to others, a sense of feeling part of a community, and friendships. As one participant put it, "The project has made me look more positively on life." Museums also co-piloted small-scale activities that prioritised trust building and a sense of belonging among project participants. And in this, again, facilitators, some of whom brought their own lived experience to their work, played a crucial role in reshaping museum and heritage practice. They helped staff to see their institutions through new eyes and identify and dismantle barriers that made their museums feel exclusive or intimidating. And for their part, kind of participants also described the museum spaces as welcoming, creative, emotionally supportive. These were places where they felt they truly belonged. Our fourth main finding was that working together paid a great deal of attention to the wellbeing of museum practitioners as well as project participants. So staff involved in the programme reported feeling less isolated and more emotionally supported. They also developed stronger professional networks and a clearer sense of shared purpose in relation to their projects. And mentoring, which was provided by the project lead, also gave project teams space to reflect, to set healthy boundaries, and to advocate for an embedded approach to health and wellbeing practice within their own institutions. Project leads, for example, described how the programme encouraged honest and reflective ways of working. And as one said, "If it had been any other project, I would have been tempted to keep going and put a positive spin on things. But working together allowed people to be honest about their experiences of creative health work, both the good and the not so good." In concrete terms, though, working together was the catalyst for several museums and heritage organisations to start embed wellbeing at an institutional level through new policies, through workforce training, and even the creation of a wellbeing focused board level role at one or two organisations. And so for us, on the programming team, this can be seen as a mark, sort of marking the beginning of a cultural shift. towards recognising wellbeing and care not as optional extras, but as fundamental to safe, sustainable, creative and ethical creative health work within the museums and heritage sector. Finally, we also discovered that kind of one of the most encouraging outcomes was the emergence of a new cohort of creative health advocates across the participating museums. So early and mid-level staff in particular gained a lot of confidence, not just in delivering programmes, but also in influencing strategic approaches to improved health and wellbeing through museum and heritage engagement. So yes, this was happening within their own organisations, but also at a sector level, because there are lots of examples of project leads who shared their learning from working together over the 2-year period through presentations and workshops at national conferences and industry shows. And also, they were developing creative approaches to collections. They were able to trial these as part of working together, particularly in terms of sensory engagement and trauma-informed interpretation. And this sort of opportunity for experimentation invigorated how project teams used heritage objects to support wellbeing. And we're going to be hearing about some of those examples from museum partners in a minute. I also invite you to look at the report's case studies to find out more about those. The next slide, please, Rachel. So, what do we learn? I think the first big lesson from working together was about pace and process. So the programme really challenged traditional output-driven and delivery-focused sort of cultures that dominate so much of the museum and heritage work that many of us are involved in. I'm not speaking for everyone here. I know we've got quite a diverse group of people, but for those of us who work in museums, that is something that we often talk about, the treadmill of delivery. Instead, working together showed that creative health flourishes when practitioners and organisations slow down, make space for relationships and experimentation, and embed care and lived experience into design and delivery. Also, the programme's generous timeframe, it was 18 months in length for those who were involved in terms of kind of project partners, and also it had a non-prescriptive structure. Both these sort of elements gave those involved permission to reflect, to take risks and make mistakes, and adapt to the emerging needs of participants and health, social care and community partners. A second major lesson was around staff wellbeing, so a cultural shift in attitudes to wellbeing. And through mentoring and peer support, museum practitioners started to see that caring for others in meaningful ways also required them to care for themselves and their colleagues. And this really prompted a change within those participating organisations towards work that was more emotionally safe, sustainable and connected. So we can talk a little bit more maybe later on about the peer support model that helped on terms of the programming side, but museums also were taking steps to try and support colleagues to enable them to do this work in a way that felt safe and sustainable. However, and as already mentioned, some of the museums and heritage organisations also started to sort of think about those leadership structures and decision-making powers, and took steps to ensure that responsibility for creative health work wasn't confined to a single staff member or department, but embedded across an organisation. In terms of co-production, it emerged both as a process and a mindset. So training was key in helping project teams move away from rigid top-down programmes design and closer to kind of flexible relational co-design projects with participants and partners. And this change in turn led to more meaningful engagement. So programming that was rooted in lived experience, real need, and a stronger sense of shared ownership over processes, outputs and outcomes by museum staff, project participants and partners. And while the result of this way of working for freelance artists and creative practitioners was the depth of connection and trust that they experienced with commissioning museums and heritage organisations, participants cited outcomes for them that went far beyond their original expectations. So we can talk about significant gains in self-confidence, opportunities for self-expression and the development of creative skills. And in many ways, I think we can talk about co-production as a process, as a practice, as a model, becoming the engine of transformation. Another striking outcome and a point of learning were the creation of peer support networks among professionals. And these non-hierarchical groups became quite safe spaces for staff to share successes and challenges, to brainstorm new ideas and to stay creative. In terms of participants, they described rediscovering joy, and staff did too. They talked about joy in their work, in their daily work. So an ingredient that is too often missing in pressured work environments, and the delivery treadmill that I was talking about earlier. And I think that sense of happiness and playfulness that sort of emerged from the project helped to bridge the gap between staff, participants, and partner organisations, and really reminded everyone why creative health matters in the first place. Our sort of penultimate lesson was around reflective and care-filled practices, and that also related to evaluation. So rather than relying solely on sort of traditional metrics and an over-reliance on quantitative data, teams that were involved in working together experimented with creative, person-centred approaches to evaluation. They used reflective journals, scrapbooks, group debriefs, and even card games to qualitatively evaluate and understand the depth and breadth of the impact of their work. And so in this sense, evaluation was not just about accountability, but another tool for learning, connection, and care. And I think I'm going to finish on a challenge, because we have to acknowledge that sustainability for creative health work remains a major challenge within the museums and heritage sector. It still relies heavily on short-term project-based funding, which makes it really difficult to sustain momentum and to keep relationships going. So some organisations that we were working with managed to align their work with public health priorities, for example, but many are operating under significant capacity pressures and limited core resources. Also, this project relied heavily on freelancers, and having the budget to be able to bring them sort of into an organisation and then keep knowledge and expertise sort of in-house is a challenge that remains, not just within our programme, but for many programmes of this kind. So the legacy of working together really depends on continued investment, not just in projects, but in people, in leadership, and in values-driven practice. And I'm just going to summarise now. So I think working together has shown us that museums and heritage spaces can be powerful places for health and well-being when we centre care, collaboration, and creativity. And it's also demonstrated that real change happens when we slow down, when we take time to speak and listen to each other, and when we trust communities, creative practitioners, and museum staff to co-create meaning and connection inspired by objects and collections. And I think also it encourages those involved in the programme to think of care as a practice. It's a way of being that shapes everything that we do, from how we work with participants to how we support each other as colleagues. And perhaps most importantly, it's a reminder that fun, joy, and curiosity are not just byproducts, to nice byproducts, but they're central to creative health work and its purpose. So I think the challenge now is what comes next. How can museums, arts and heritage member organisations like GEM and CHWA, who oversaw this programme, and also funders, further embed creative health work into the core of our institutions, nurturing the people that make it possible, and continue to help building partnerships rooted in trust and generosity, not without critical reflection too. That's also really important. And if we can all collectively find a way, then I think the legacy of working together will be more than a disparate set of pilot projects across England and Scotland, but as the directors in GEM and CHWA write in their foreword to the report, a call to action to build a more sustainable, inclusive and resilient future for museums as community health assets. And I really hope that's the case. Thank you very much.
Thank you, and thank you very much, Sian, for all your work on this project. It's been, as you say, it's been really, really great that you've been involved right from the beginning, and you've seen every step and every stage, and the challenges as well as the opportunities. So thank you. Thanks for all your work on the report, which I'm sure everybody's looking forward to reading after this session as well. So I'm really delighted that we're going to move on now to talk with talks from two of our museum leads. So they are going to tell us about what's happened on the ground from their perspective. So we have Jo Valentine from the National Museum of Royal Navy, Portsmouth, and Kashid Hussain from the Prince Philip Maritime Collection Centre, Royal Museums, Greenwich. So Louise, who has been an absolutely amazing project manager, by the way, Louise Campion, on this project, also needs our thanks for her amazing work. She has been on a secondment from her sort of full-time role in Bath, and she's been really great on this work moving forward. So thank you very much. Louise is going to interview and sort of chair this part of the session, and hopefully my slides will work. Sorry, my right button's sticking, as you probably noticed. Hang on.
Brilliant. Thank you, Rachel. So I'm going to invite Joe and Kashid to have a question and answer session with me. And the first question I'm going to ask is, what did we learn? So both Joe and Kashid were leading projects in their museums, so they were two of the partner projects. So we'll start off with the next slide, and what did you do in your museum? And we'll start with Joe.
Okay. Hi, everybody. Can I have the next slide, please? Hooray, thank you. Right. So as we know, engaging with our collections and stories can be a real boost to health and happiness, but there are many barriers involved with getting some of those stories into different places. And the place that we decided to work with was our local hospital. And especially in Portsmouth, HMS Victory is very much an iconic symbol. Everyone's connected to it in some way. Either they've gone to a school called HMS Victory, they've gone to the ship. I mean, even people have tattoos across the chest with HMS Victory on it. But the idea was to spark conversation, laughter, and reminiscence around HMS Victory. So we did two separate projects. We did some with the adults team in the hospital and some with the children's paediatrics team. So we co-created with the adults history theme, no, not history themes, it was wider themes. So a great day out, meet the crew, love box, an artist muse, and 100 years in the harbour. Now these were purposefully not historical themes. This was about encouraging storytelling, memory and connection, and links in then into the history connected with the ship. And then we also asked and worked with the children, as you can see on the slide on the bottom right, if we were going to create a play box, what would you like? And they said, what would you like it to look like? Some people said treasure chest, and others said, could you make a little ship? So we made a miniature version of HMS Victory, and each of those drawers and come out and can be used on the children's tables in the hospital beds, so they can literally use it where they are. And that was the contents of that was developed with the children's ideas and the staff from there.
Thank you, Joe. Kashid, can you tell us about your project and what you did?
Yeah. Next slide. Oh, next slide. Cool. Thank you. Yes, so hi everyone. And we actually ran two projects also. So after some consultation with our local community, we decided to have two projects running. One was called Open Waves, which was a free wellbeing series for ages 25 to 45. From African Caribbean communities, and this project was co-produced with Tracy Durant from Everyone's a Singer, and the session was led by audiovisual artist Jasmine, and participants were able to explore the objects from our collection centre here. And responded to them through storytelling and music technology, and also personal reflection. And then together they created original audio pieces, which will be in the museum's engagement collection here. And that's all through kind of like experiences from themselves and lived experiences. And then the second project we ran, which was called the Optimism Sessions, and that was a creative wellbeing program again for people aged 18 to 24 of the global majority. This was co-produced by Gabriel Deji from an organisation called Less Talking, and it was led by an artist poet called Joelle Sydenham. And participants gathered each week to freely express themselves through art, play, and reflection. And they were encouraged to explore the objects within our collection and to rethink the world that they lived in, exploring how they can affect it positively. And throughout the whole process, I was also supported by a critical friend called Daniel Regan, who offered lots of guidance and thoughtful advice, which was really helpful.
Thank you. So the next question for both of you, starting with Jo, is what did you learn?
Well, a couple of things really. I do 4 days a week. There's only one of me, and I know, like a lot of organisations, there's not huge big community departments. So I discovered that actually creating a working party with I feel like they're my new colleagues in the hospital, helped tremendously. It gave me that sounding board, and we were working together as a team. And because they're creating it with you, you know that they are going to be delivering this, not me. The staff are going to be delivering this. So we needed to make sure we made something that worked for them in their setting. And then that has more, hello, Michelle. And that has more longevity as well. Also, they are sharing that work in places that us as museum professionals wouldn't necessarily take it. So things like nursing conferences, areas of health conferences that I wouldn't automatically go to in my head. Thought, oh, okay. Major thing I've learned is being more visible with my community work. We've got an internal system called Blink, which is a bit like Facebook, but not Facebook. And I've been blink bombing everything all the time. So I've been putting photos of my work, and it's not just about opportunities to share what I'm doing with trustees and senior leaderships. It's also with my colleagues. So many people help create the chatterboxes, from the guides giving me gruesome facts to put in there, but also the finance people when I am sending them weird receipts for wooden fish and chips, and it's nice to show them where this stuff ends up and that they're a big part of that team. But finally, the bit I learned really was the working together events and the mentoring from Louise, and that connection in with other people doing similar things, going through similar types of problems, and not always problems, but just that sounding board was incredibly valuable for me, and I'm very grateful for that. And it also, professionally and personally, it just gave me that breadth across the country, and then kind of made me feel more confident about my work. Go, actually, I might be all right at this, which I don't think we always do if you're still in the same space all the time.
Thank you, Jo. Kashid, can you tell us what you learned? I think you can go on to the next slide, Rachel.
Thank you.
Yes, I think this is my photograph. Yeah, so I mean, totally agree with what Jo said as well. And I think what I learned is that building a dedicated community from scratch takes time, takes care and consistency. Meaningful connections don't just happen overnight. They grow through shared experiences and open dialogue and kind of like genuine engagement from those people. So taking the time to listen and understand people's values and stories and aspirations can help create a sense of belonging that lasts, especially within partnerships. And developing those partnerships with local communities and organizations is really key. Collaborating to create co-developed programs is also something really important, because it reflects kind of community's heritage, and we can respond to needs that ensure that we are offering something that feels relevant and inclusive and empowering. And all throughout this, it's just kind of highlighted how museums can really play a vital role in this process. PPMCC in particular is a really unique place where acts of creative well-being
can take place within society, and can also offer people opportunities to connect with culture, history, and objects, and then also connecting with each other as well. And also, as Joe mentioned, and I just wanted to highlight that there are so many other kind of like professionals out there who are really going through the same thing, and it's really nice to kind of like have a network where we can speak about it.
Thank you, Kashid. So next question is, what was the biggest challenge when you were involved in the projects? So Joe.
I think really, like many of us on the call, time pressure of this does take time. It's skillful work, it's careful work. Building and maintaining relationship is not a quick thing. I also wanted to really enjoy this process, and I did, but also there was a lot of pressure at times of wider organisations of, we need to deliver this has got to be happening, boom, 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 all at the same time. And that made me cross. But the difference is I would have got cross previously, tried to do it all and stewed. This time, because I felt more confident and I felt like my permission to go, hang on, I paused, took a deep breath and went, I'm pushing back right this moment and say, sorry, I can't do that. I can do this, but I can't do that. And I need to finish this now. And giving permission to push back. And they were very receptive. My, senior managers were receptive. Yep, okay. And moved things around and gave me the space to finish the chatterboxes off. And I was, that's the thing that was the challenge. But it also showed me that if I do go, hang on, rather than yes all the time, things will change and they will respond and listen.
That's so good to hear, Joe. Really good. Kashid, can you tell us about your biggest challenge? I think we can move on to the next slide.
Yeah, so I would say I had several challenges and barriers that affected kind of the projects that we ran. One being location, major fact, but just something that I cannot change. We are based in Kidbrooke, so the Prince Philip Maritime Collection Centre is here, which is kind of on the outskirts of London. There is public transport links, but I can totally understand if you're coming to a session for wellbeing, why people might not necessarily feel comfortable coming to a space like this, especially doing a journey that they don't know about. Additionally to this, audience reach, from the audiences that we are trying to reach through this project, it's not our regular audience. So engaging with new participants was quite hard, and requires a lot of kind of like sustained outreach and trust building. And then also participants numbers, it fluctuated a whole lot. I remember having a call with Louise. I was just like, help me. It went up and down, but again, kind of like seasonal change. We did our first round of pilot projects in October, November, December. So it's just very dark here, and it's kind of Christmas time, and people are doing other things. They've got other commitments. And it was hard to kind of keep or maintain consistency and momentum, especially when some participants were coming because they wanted to make connections with other people like them or who have similar interests. And lastly, similar to what Joe said, timings. Other than like obviously we had a time scale of we were meant to do these projects, it was also timings within when do we offer these projects to people, because of the age ranges we were looking at. People were either at work and then would go home, or they're at school or college and go home. So it was trying to find a time that kind of fitted with our staff's availability or my availability here, freelancers, and then also people coming to these sessions. So that was kind of like a logistical ongoing challenge that we had.
Thank you. So my last question for you both, starting with Jo, is what will be the legacy of this project for your organisation?
Can I have the next slide, please?
Give me a minute. It's decided not to work again. Right, keep talking. Oh,
Okay.
Oh,
Look, that one. There we go. It's our little ship. So I think really, as it's gone on, I feel like it's two organisations. For the hospital as well, we realised that this and the chatterboxes can work across multiple audiences. It's not just children and the dementia ward. We've actually realised that this could help out so many more people across the hospital. So the legacy of that work will carry on. We've also sort of agreed to evaluate over the year to see where we can go next with it. It's a partnership that now has been formed sort of permanently. So we'll see how we can work together to improve people's experiences in the hospitals, and by providing resources that are on our doorstep and within our gift, as it were. For me, I also think the organisation is prioritising the experiences of people working with trauma, like myself, and also people who have come through to the museum with trauma. There's different policies now in place that's really being prioritised, and the effects of trauma on this, working with people with trauma on the staff as well. We've got a great head of service. She's engaged and it really understands now like that full nature of the work and the implications of it, which is particularly useful as we're now working now on the Royal Marines Museum. As you can imagine, there's lots connected in with that. So it was really, really wonderful that it's the trauma informed working has arrived at the right time.
Thank you. And the same question of the legacy to Kashid.
Yeah, so I would say we have
Next slide, please.
next slide, sorry. Short-term kind of legacy. For both projects, we want to create a web page that documents the project and share the outcomes that we have. For Open Waves, which is the photograph on the left, we are hoping to create QR codes linking the audio pieces that they created during Open Waves, placed alongside objects that they were inspired by, offering future visitors a chance to hear participants' creative responses in situ. And then with the optimism session, we created a zine, which you can see on the other side. So again, this is to be available on the web page, given to participants that partook. And then, yeah, if anyone else would like to have a copy, then it would be available for them. And then long-term, embedding the learnings from both pilot projects within our current programming, noticing working with smaller organizations for co-production is kind of the way forward to go, especially for creative health and well-being, and especially ones that have communities' needs in mind, but might just not have the presence for it because they're a smaller organization. And then also, so sorry, these are long-term ones, and then advocating for creative health and well-being within our organization and creating awareness around it. And particularly seeing how PPMCC, the Prince Philip Maritime Collection Centre, can be a really good resource for it due to the environment that we're in, and what we have stored here as well, for the community.
Thank you. Thank you, Kashid and Jo, for sharing your stories. And if people are wanting to see more, in the evaluation report, there's 6 case studies which give you more detail from all the other museums as well that took part. So we're going to finish with the recommendations from the report. So we've split them into different sections. So we've got recommendations for museums and heritage organisations, and then recommendations for the Culture, Health and Wellbeing Alliance and GEM, and then finally for funders. So for museums and heritage organisations, thinking about leadership and organisational culture. So the recommendations are to think about assigning someone from senior leadership teams to be responsible for health and well-being across the organisation, ensuring there's a champion at a strategic level and it's not left to the learning and engagement officers, because you really need somebody at the top leading and talking the talk. And also visibly, those museum directors and senior managers visibly engaging in health and wellbeing conversations. So they are the ones that are having the conversations in the organisation, because once they start talking, everybody starts talking, and creating feedback loops where staff can see how their insights are being acted on. So also, thinking about reviewing and updating learning, participation and community engagement, staff and job role descriptions, so that those role descriptions include wellbeing responsibilities. So it's that invisible work, it's that careful practice, really, really highly skilled, that if I look at my job description, it isn't there and it needs to be identified because they are professional skills and written into job descriptions. Acknowledge and plan for the turnover of staff, both at museums, heritage organisations and partner organisations, by embedding training and reflective practice so that if one person leaves, the whole thing doesn't stop. What you want is for it to be sustainable and embedded in museums so that it will carry on if that champion moves or leaves, that other people are there to carry that work on and have the knowledge to do that. Acknowledge and plan. Sorry, I've said that one. So creative internal communities of practice. So in the museum I work in, we've started a community of practice for all our freelance artists, and it's just such a great way of everybody supporting each other and sharing good practice. And that could include mentoring structures to support staff delivering creative health work so that they aren't isolated, because this work is hard and you need, as Joe and Kashid have said, that network of people around you. And it's great if they're in your organisation and you can just have a chat or a coffee, but also to share good practice as well. And that's between staff and also your freelancers. Put in place supervision, support structures for staff who are delivering this creative health work, which is really important to have somebody to go and talk to if you're struggling with something that's come up. You need somebody that you know you can go and speak to, that you respect, and that could be outside your organisation. So for instance, I get clinical supervision from my mental health trust, so you can find that supervision. Develop longer term, more formalised relationships with third sector partners to ensure health and wellbeing work is embedded beyond individual projects. And that's very much what Joe was talking about. And lastly, communication and advocacy. So developing communication strategies that publicly acknowledge and celebrate creative health work, especially when it responds to local needs, and using case studies and press engagement to raise that visibility. So that's all about external celebration and the way that your museum celebrates this work and tells the world about this work. Next slide, please. So those are those were the kind of recommendations for the museums and heritage organisations themselves. These are for culture, health and wellbeing in GEM, because this project was funded with the idea that it would galvanise creative health with work within the sector and really provide sector support. So what is the learning that Chua and GEM are taking away? Well, we need to continue to grow the partnership. And we're going to do that, as Rachel mentioned at the beginning. We developed a training program for the museum leads, but we now want to share that with other people. And so having run that, GEM is launching a course, which we will share, so that you can have a look at that. And it's starting in January, and that will be covering some of the things that we covered with the museums, things like boundaries, things like thinking about representation and well-being, and how if you do or don't see yourself represented in a museum, either as a staff member, as a volunteer, or as a visitor, how that can affect your well-being and sense of belonging in that space. So that GEM training is coming online. Also thinking about adding museum and heritage partners to the mailing list. So if you're not a Chua or GEM member, then please do have a look at joining the organisations. They're going to organise an annual partner catch-up, so all those 6 museums can come together and do a little check-in with each other, and providing a resource pack for all the training that we've already done. Another thing that I think it would be useful for everyone is, which we haven't actually mentioned, that the 6 partner organisations had a small project budget. This was to pilot their work of 15,000 over the 2 years. And I think, how do you spend that kind of money? It could be less, it could be 5K. And thinking about some really cost-effective approaches to, if you've got a small pot, what is a really great way? And I know our 6 partner would be able to share that information. This is how we spent our small project money. This is what we did with it. Thinking about those templates for role descriptions for wellbeing and mental health work. So Chua and Jem will be looking at that, and providing an audit tool outlining ways to embed mental health support aimed at trustees and board members. And also thinking about delivering future training and guidance on how to apply for creative health funding and ways of prioritising core costs to support wellbeing work. So those are the things that for Chua and Jem they're going to be looking at. And finally, for funders. So what is this report and everything we've learnt? What is the message for funders? Well, unsurprisingly, and I'm sure lots of people at this event will know this, recognising the value of process-driven work. So reducing emphasis on the scale, that you have to be reaching hundreds and thousands of people as a primary success measure. Instead, funding models and evaluation criteria should recognise the value of person-centred, relational and process-led approaches that deliver a meaningful, even if they are smaller scale impact. Because if you are really working with even 1 or 2 or 5 or 6 people, if that really does have a significant, profound effect on that person's mental health and well-being, then it's worth it. And also to funders to support existing and proven programs. and to prioritise funding for programmes that have demonstrated positive outcomes and strong community relationships. And sustainability should not require reinvention, constantly coming up with new ideas, but instead strategic scaling and adaptation. And finally, to address structural barriers. We are working in times of austerity. There are staff shortages. There is insecure funding, which directly limits community engagement and creative wealth in health work in museums. And this should be recognised. Create funding streams and policy levers that address these systematic issues, including funding core wellbeing roles and embedding wellbeing metrics in sector-wide evaluation. So those are the messages in the report for funders. And just before we end, we have 3 minutes left. Could you just go on to the next slide? The last things that I think
Give me a moment. There we go.
thank you. All of us, everybody working on this project would want to just say again, is the idea of permission to pause. That's what Jo mentioned. And I think anybody working in museums, but also doing this work, creative health work, working in partnership, giving yourself permission to pause, and the value of reflective practice. You can see on the slide, this is somebody from the Scottish Maritime Museum. At the beginning of the project, Sian invited everybody to have a beautiful reflective diary and to keep that diary. And we asked people every week, give yourself 10 minutes away from your computer, take your book with you if you want, and just stop and think about what you've done and what you've learned and your reflections. And that is so important, because if you don't have time to reflect and process what you're doing, you can't learn. You're not giving yourself time to process. And whether that's joy, whether that's frustration, give yourself that time. Reflective practice is so important. And along with that, prioritising staff wellbeing, investment in people, in highly skilled people who are delivering this work, whether they're managing it or actually, in the room. This is emotional labour, and it's professional, and people need support in order to do this work, and it's important that we acknowledge that. So I think we're at 3 o'clock. So thank you for joining us. I hope you've enjoyed what you've heard, and it's also landed with you and resonated with you. The next slide just shows where you can find the report. So it's a link on the Culture, Health and Wellbeing page, which is dedicated to this project and the legacy of this project. So you can click on that link and the report is there. There's also going to be some films that are there or will be there, so you can see actually the people involved talking about their experiences of these projects. Thank you.
Thanks very much, Louise, and thank you also to Sian, Jo and Kashid. You were all brilliant, really gave a very detailed picture of the programme and the change that it's enabled. So thank you to all of you. Thank you to the Heritage Fund for having the kind of vision to support this work, and for everyone for coming along today. As we've said, there is a sort of legacy training programme that's actually free because it's supported by the Heritage Fund. So we've advertised that as a cohort. So if you're interested in taking part, then you need to apply. We've sent the link. Thank you, Kayla, for sending the link. And also, please do read the report, and good luck as well with all your health and wellbeing work. Yeah, just if you need any advice and support, then you do come to any of us. Yeah, if you've got any further questions. But thanks very much, everyone. And thank you again to Louise for all your hard work coordinating this amazing programme. Thank you.